गुड इवनिंग ऑल। सो वेलकम टू टुडेज फेसबुक लाइव प्रोग्राम। और आज अपने फेसबुक लाइव का विषय है अल्कोहल एडिक्शन एंड अवेयरनेस अबाउट हाउ वी कैन स्टे अवे एंड वी कैन कम आउट फ्रॉम दिस अल्कोहल एडिक्शन। सो आज इस विषय पे हमारे साथ बात करने के लिए है डॉक्टर राशि अग्रवाल मैम। सो मैम इज एमडी साइकेट्रिस्ट एंड शी इज कंसल्टेंट साइकेट्रिस्ट एट मेडिको होम मेरिट। सो मैं मैडम से रिक्वेस्ट करता हूँ मैम, आज आप टुडेज टॉपिक के लिए आप स्टार्ट करिए।
Hello, everybody. Thank you so much for joining in. And today we are going to talk about a very important topic. And yes, that is alcohol use disorders. So I will be very quick and I'll tell you the main points. And specifically, I would like to talk about alcohol use disorder in young people. So first of all, before we start, we have to establish the fact that alcohol disorder is like a medical issue. It is a psychological issue. It should not be treated as something like कि ये जबरदस्ती कर रहे हैं, ये अपने आप कर लिया. So the day we start treating as mental health issue, we can look it more objectively and we can start treating it also in a better manner. So if you or if anybody around you, you know somebody who is going through the same, please seek help for them as soon as possible so that they can get over this and live a normal and a better life. So alcohol use disorder होता क्या है? किसी भी कोई भी सब्सटेंस अगर कोई पर्सन लेता है जिसके लिए कुछ क्राइटेरिया फुलफिल होते हैं, जैसे कि फॉर एग्जांपल टॉलरेंस डेवलप होना, यानी कि पहले थोड़ा लेते थे फिर थोड़ा ज्यादा लेते हैं, देन और ज्यादा लेने लगते हैं. तो इवेंचुअली दिस इज हाउ द टॉलरेंस बिल्ड्स अप कि उतने ही एंजॉयमेंट के लिए हमें ग्रेजुअली डोज बड़ी करनी पड़ जाती है. सेकेंडली, इवन आफ्टर नोइंग कि इसके इतने सारे साइड इफेक्ट्स होते हैं, people still continue to take that, meaning they have a difficulty in stopping themselves, difficulty in restraining themselves from taking that. Number 3, they don't find pleasure in other activities and they're so involved with that particular substance intake that they're not able to think about anything else. They just want to do this again and again. Number 4, if without taking this substance, usko bina liye, they have this kind of craving, they have this kind of issue that I'm having restlessness, I am having uneasiness, or any kind of feeling I'm having that stops me or that pushes me again and again to take that substance. These are some signs if you feel that people around you are taking any kind of substance and they're falling under these category, at least in 3 of these category amongst all of this, that they are severely having a craving and want to take that again. They have complete loss of control, that they're not able to stop themselves from continuing further once they have started. When they withdraw, they have complaints like nausea, vomiting, sweating, and feeling sickness to their stomach when they're not drinking. And yes, as we discussed, tolerance. So at least any 3 of these, if they are having in the past 1 year among the 7, we will say that they are having alcohol dependence syndrome, like they're having an issue about it. Now, what is the problem in this? Everybody reacts to alcohol very differently. And hence the treatment also will not be very blanket treatment. It is very tailor-made treatment that people are given that as per what their complaints are having. So usually it is like a person taking, how do we say that person is drunk or still hangover? So if after 9 large drinks or even 18 small drinks during the last evening, if the alcohol is still present in next day afternoon, we can say that the person is having such kind of hangover or still present in the body. Now, what is the problem in this? First of all, anything that goes through your body is metabolized from your liver. So your liver is also affected, and gradually, slowly, the liver starts giving away and the liver gets damaged, which we can very frequently see in the ultrasounds and the liver function test. When we come to the mental health aspect, we try and find out that why. So many times alcohol is both the sign as well as a symptom of the issue. So if a person is currently taking alcohol, what they can do is that We need to find out why this is happening. So either it is a symptom or it is a sign of depression or anxiety issues that is reflecting, or it is because of that the person is taking. So we need to dig deep, dig down. Many times it is not the alcohol dependence, it is the other mental health issues because of which the person starts consuming alcohol, and they are trapped in this loop. Like if a person starts taking from here, it builds up their tolerance. Then they try to quit. Then there is this quitting phase. Then, due to some of the other reason, they enter the phase again due to relapse. And then they're trapped in this cycle again and again, taking and leaving. What happens is that when you do this again and again, it becomes very difficult each and every time for your body to leave. Hence, it is important to be under treatment with a lot of psychological management, like motivational enhancement therapy, rehabilitation therapies, cognitive behavior therapies, relapse prevention therapies, as well as medicine. So therapies will take a lot of psychological, bring you a lot of help in that way, and medicines will give you a lot of help in your physical symptoms, in your psychological cravings, and also prevent the relapse that's happening again and again. So usually in studies, it's very commonly seen that in 10 to 19 years of age, if the person has tried alcohol in one or the other sense, there's very high chance that later in life they will do more risk-taking behaviors. So it could just stumble upon being into severe illnesses also, like nicotine dependence, like complete cigarette dependence, or further progressing to opioid intake, to complete smack, cocaine, and everything else. Now, why does this happen is because whenever you take this substance, there is increase in the dopamine, which is a brain hormone, and it suddenly rises. So there is a feel-good feeling. And then when the alcohol rate starts dropping in the blood, the dopamine slowly come down. And that's when the person gets an urge to take it again and again. So it is a very scientifically researched topic. There is a lot of basis, a lot of help that's available out there. There are so many factors here which we can consider, like the number of attempts a person has made for their prevention, the duration of them, the reason why you want to leave, or the reason why the person started again, why they are wanting to leave in the first place after such a long time, and what is the main issue that is compelling them to go in this cycle again and again. Family history is very big deal. If there is a strong family history, there's a chance that the person might do this again and again and end up in this loop without any help. So for medicines, there are so many available. You can consult your nearby psychiatrist and get the right help in this uneasiness, tremors, decreased sleep, and increase craving again and again for your alcohol. As well as just discuss, a lot of therapies are out there which are available, but any of these should not be taken without a proper supervision, without a proper assessment for your depression issues, for your anxiety issues, because we need to get to the most bottom part and completely wipe out all the complaints from under there so that you don't get into this cycle again and again. If you have any other queries, if you want to ask about more and more stuff about why this is happening, or why there are not so many warnings around, and why alcohol is being sold so easily. So these are the bigger issues which are present on a larger level. And yes, they need to be dealt with, but we need to be concerned about our personal safety, the safety of our family members, and ensuring that we live a good and a healthy life without any bad substances coming and affecting our physical and our mental health. So first and foremost, there is harm reduction, and then we work upon making it a better place and a better body for you to live inside. Any more queries, I'll be really happy to help you out on them. Please feel free to ask them. Any queries on alcohol de-addiction?
Thank you very much, ma'am. So I think so your entire the discussion for last whatever the information which you have given, that was definitely wonderful and useful for today's viewers. Ma'am, here a couple of questions as we will take it here, ma'am, which are generally there in the mind of either alcohol addict or their family members. So first, as you said, ki there are medically or scientifically driven concepts are there. So why there's the repeated craving happens. So if it is a scientifically or medically studied, so can we consider alcohol addict is a disease?
Yes, absolutely. That is from where I started my complete presentation, that जब तक हम ये सोचते रहेंगे या the more we think that this is kind of a zid or this is what you are doing just at your own will, we will not be able to completely treat the person or try to help them in any manner. Once we start understanding them like illnesses, similarly, like I would not say to a person of diabetes कि ये क्यों कर लिया आपने अपने आप को. There is a lifestyle change that happened. Obviously, there is a family history, but yes, there is also predisposition in them. Similarly, the day we start seeing it as an illness, when we assess, we keep the person aside, we keep the illness aside. And that's how we go into psychiatry, that literally reading minds. And that's how we try and solve it from completely ground level below. एक्चुअल प्रॉब्लम को पकड़ेंगे, उसको सॉल्व करेंगे, तभी ये प्रॉब्लम जा सकती है. अगर जो नॉर्मल घर वाले या आसपास वाले बोलते हैं अरे पीनी छोड़ दो कोई बात नहीं, इट्स नॉट दैट इजी.
Yeah, ma'am, you rightly said we should complain about the act, not the actor, like this. So the sharab buri hoti hai, not the sharabi, like this. Yeah, and that's what we need to, as a society or as a family or as a caregiver, we should understand that it is a medical condition and that patient requires some medical help similar to any other illnesses in the society. Ma'am, my second question is related to the role of family and the support members in the family or in the relative, and how important their role is in the rehabilitation of this entire alcohol addiction, ma'am.
Okay. As I said, the psychological illnesses or things that come under psychiatry, they require very, very strong family interventions. We do not mean that we always are cursing the person and always blaming them for their issues. I'll just quote some studies also I have over here. So there are some family-based interventions. There are a lot of studies which were done with people who did not have family support and who had family support. It was clearly seen that persistent abstinence came among people who had a good family-based intervention, meaning like involving the family also in the plan, the family supporting the development of the person, they're bringing them for regular follow-ups, a nurturing behavior at home, some clear boundaries established, kind of a monitoring also, but also this kind of relaxation that the person feels that they're in charge, but still the family is kind of watching over them, but also supporting them. So that is why we never, people must have seen that when you go to your psychiatrist, they always ask for your family members. And generally people get scared and they ask, why do you want a family members? So by a rule, kind of a rough rule, we always ask for family members to bring along. We want to see what kind of a family you have. We want to see what kind of educational level, what kind of understanding they have about the illness. Because if they're not even aware about what illness they are having, if they're not aware about what is happening completely, then they will not be able to support you in their wellness journey also.
Definitely, ma'am. Thank you very much. My next question is, as you said, the family should also support them and work as a support system. So my next question is related to how the important this group therapy in the rehabilitation process. So when patient visit to the doctor, it can be the individual therapy, but when in the rehabilitation process, does the group therapy helps?
बिल्कुल करती है. I will give you some few pointers also why it happens. So a lot of us must have watched these English shows on Instagram or short series or on Facebook and Prime on Netflix and everywhere, and we have heard these words called Alcohol Anonymous. उसमें क्या होता है, एक लॉन्ग स्टेप प्रोग्राम होता है जिसमें कि बहुत सारे लोग एक साथ आके मिलते हैं, कोई नाम शेयर नहीं करते, बट दे ऑल टेल देयर स्टोरीज. वेस्ट में थोड़ा सा कॉन्सेप्ट ज्यादा इस्टेब्लिश्ड, इंडिया में भी है, बट बड़े सिटीज में, छोटे सिटीज में अभी इतना नहीं फॉलो होता. यूजुअली पीपल कम टुगेदर एंड दे डिस्कस देयर इश्यूज, particularly saying that, okay, I had this issue, now I'm alcohol free for this much time and this has changed my life like this and like that. So what happens is that in psychological perspective, I do not feel alone. if other people are also sharing their bad things, as well as how it helps them after leaving, or what kind of changes they have done. There are kind of amendments that you do, that while drinking, while abusing, did you do any harm to other people? So you also negate that. So Alcohol Anonymous is a very strong term and a very strong therapy that goes all over world. There's mostly they are run without supervision, but it's better if they're under a psychological supervision also. So people come together, they get this shared feeling ki acha, other log bhi mere saath ye kar rahe hain. Plus they get this motivation to go again and again, and they have this kind of feeling that, oh, I should not start drinking it because I committed to so and so person. You can become a sponsor for some people, and like you can take somebody who's freshly left alcohol also under your wing. So it kind of becomes a cycle. You become responsible for to other and from others also. So group therapy is a very, very effective, not just in alcohol, I would say in a lot of psychiatric illnesses, because these issues are very isolating. We feel that we are in them alone, कि मेरे साथ ही हो रहा है, बाकी सब तो बहुत खुश हैं दुनिया में. So you start having this feeling that, okay, it's normal to feel this way. It's normal whatever is going on around me.
And I think so it also helps to remove the taboo of this. Ki, I am the only one who is getting suffered. So this type of mindset or the feeling of isolation can also be get wiped out with this type of group therapy, ma'am.
Absolutely, it does.
Yes, ma'am. So, ma'am, thank you very much for your valuable time for creating these the awareness and joining us on this Facebook Live. So thank you once again from the team of Health NU and the Dosti de-addiction awareness program, ma'am. Thank you very much for your valuable
Thank you. Thank you so much for having me. And anybody else who needs consultation or needs help, please drop down comments under the video so that we can help get you the right treatment at the right time. Take care.
Yes, ma'am. Thank you, ma'am. Thank you very much.
Bye-bye.